Hi, everybody. I'm Alicia Quella. I am the Director of Communications and PA Relations at the NCCPA. A little bit about my background. I've been a PA now for 2+ decades and have practiced in emergency medicine, primary care. I'm also an epidemiologist, so I've done some work on clinical research and infectious disease. I've been a professor and a program director, and now for the past almost 3 years, I've been with the NCCPA. And I'm here with John Bradford. I'm going to let John introduce himself.
So, hello, my name's John Bradford, and I am a practicing PA in emergency medicine, working in Yellowstone in Alaska. I've been on the board of directors for NCCPA since 2018, and coming up on this year, I thought it'd be a great idea to, and I kind of pushed Alicia to sit down and chat a little bit about our common background in that we both served in the Peace Corps, which if you are a Peace Corps volunteer, you know how impactful that can be on your life. And there's nothing Peace Corps volunteers like to talk about more than their service, even though most folks might find that kind of boring. But I thought it'd be fun to sit down with Alicia and talk about that a little bit.
Definitely. And when I was in the Peace Corps, we were fortunate that the program that I went to the University of Iowa, they actually counted my work in the Peace Corps as my medical experience because I worked in 2 different hospitals while I was serving as a public health volunteer. And so I was fortunate that that work was counted when I came back to get my Master's of PA Studies degree. So was that the case when you went through too, or how did you start?
So I actually, how old were you when you went to?
Well, it was after college, and then I was a Peace Corps. So I didn't go into PA school till I was about 26.
Yeah.
So I was a little older.
Yeah. So I was actually 40 when I joined the Peace Corps, and I went with my wife. We went to the Solomon Islands, which is, it's about 3 hours east of Australia, a couple of hundred islands out there. But we decided that we were going to do this just looking for something a little different to do. We tried Peace Corps before, but there were some administrative barriers to our doing that then. So, when the opportunity came up again at a time in our lives when we could actually do this, we were able to do this as a couple, but we were a little bit older than the traditional. But my cohort at the time was mostly married couples, which was kind of interesting. It's different from
Definitely different.
Most Peace Corps cohorts. So
Yeah, I would say my cohort was mostly single individuals, mostly between the ages of 20 and 30. I mean, you have to have a college degree, of course, but just varying age. So I would say from 23 to 27 was the average age of my group.
Such a great age to send
Yeah.
kids overseas to live on their own in a foreign country.
Oh, and it was interesting.
What kind of trouble could they possibly get into?
Oh, right. Yeah, it was definitely a time in your life when you had to mature very fast,
Yeah.
and or you would learn the hard way, right? You had to mature because you're living on your own, you're living in a different culture, you now have a regular job,
Yeah.
you're doing this job usually in another language that you don't speak that well, and so there's a lot of growing up that happens.
It's true. You also learn how to make bucket wine, which is also a very important skill to have.
Every Peace Corps volunteer probably knows how to make some sort of wine or beer. In my area, we made beer from honey, actually.
Yeah. No, we used to tropical fruits because that's where we were.
Of course.
So yeah. Quality, but anyway. So our service was great. We actually did a little bit of everything. We were teaching in a small rural vocational school, so we were actually teaching computer skills and helping people write resumes and interview for jobs. We had 3 old computers that were donated from Australia and a 1/4 mile of extension cord to the closest electrical outlet. And so every now and then, as we were doing this, the owner of the electrical outlet would decide he wasn't getting enough money from the school and he would unplug us.
Oh,
And,
you guys had electricity?
exactly. But we also taught a little bit of, there was a hospital there, and we were both nurses at the time, and we did some education for the nursing staff there. Some of the newer things that they were seeing, a lot of Western style diseases that were relatively new to the populations there, as they were exposed more and more to Western foods and Western lifestyles. So these big increases in things like diabetes and hypertension that weren't commonly treated. So there's a little bit of opportunity for education.
And what about medications? Did you have to tailor your advice to people depending on what was available for them?
Yeah, I mean, resources are always scarce. The further away you get from big cities and these developing areas, and what they had really depended a lot on, what people were donating at the time. And so sometimes you go in, you would have these sort of things, and we could teach to these things that they had at the time. The next time we go back, those things are all gone, and then there's something else, if there's anything at all. So a lot of what we focused on at the time was lifestyle as a way to treat these things. People were getting exposed to all these new foods and ideas without really appreciating the ramifications of those things. So there was a lot of good education. There was a lot of good opportunity to work with the local healthcare workforce at the time.
I would say mine was very similar. As a public health volunteer, we were asked to first teach on diarrheal diseases, because the under 5 mortality for diarrheal diseases in the country was very, very high. And
it still is. I mean,
still is.
yeah,
like, it has not
it's like
changed
the
much.
number one killer of children in the world. Yeah.
So I actually would teach how to do ORS, oral rehydration solution, which is a controversial topic. But at the time while I was there in the 90s, it wasn't commercially available. So you had to, teach how to make it.
You had a recipe.
Yep. And so I would do a lot of groups, and we'd work on it, practice tasting it, all those different things on how to make it. And at the time, there was a custom that if a child was very sick with diarrhea or vomiting, they would actually stop giving fluids, because it would actually stop the diarrhea and vomiting. And it was not well known that they were actually causing more damage, of course. And so we talked about how you could administer fluids very, carefully and slowly to, introduce that rehydration. But that was one of the main thing. And the other was HIV/AIDS. I did a lot of HIV/AIDS education in the schools and in the hospital while I was there. And at the time, there was very little known about it. So I had to talk a lot about misconceptions of HIV/AIDS and what it was and why it was happening. And so that did take up a lot of my energy, or just efforts, while I was there.
And you told me before that you worked in 2 different hospitals, right?
Yep. There was a missionary-led hospital that I worked in. I was able to follow a surgeon around, and I often worked as an interpreter in that hospital because I spoke the local language, which is Sango. And we all had to have a working knowledge of French because the national language is French. But all the people that I would work with all spoke Sango. And so I would often be the interpreter for physicians if there were visiting physicians or nurses, to help them kind of navigate what was going on, getting explanations about things and relaying that back to the medical providers.
Yeah. One of the things that, one of the reasons I wanted to sit down with you, Alicia, and talk about this is because this kind of led me into being a physician assistant. Peace Corps supports the volunteers. They have medical officers, and I don't know what your medical officer, if it was a local, a national, or somebody from the U.S., but ours was a U.S. Physician assistant, and he supported the volunteers. I forget how many. There was about 100 of us, I think.
Wow.
And pretty spread out. So a lot of what he was doing was by phone. Up until that point, I'd been a nurse for quite a while, but I had never really heard of physician assistants. I didn't know what this was, and then I meet this gentleman, this guy, and it's like, this is pretty cool what he's doing. We're over here, we're overseas. He's doing all of these things, and I don't want to say making it up as he goes, but he was making it up as he went. But a lot of education. He did a lot of education. He did a lot of treatment, and giving us a lot of resources to use when we were in these resource poor areas, and he was a long ways away. So his name was Bill Farmer, and shout out to Bill if he happens to be listening to this podcast. When I returned to the States, I thought, this is pretty cool. Mm-hmm. And so that's when I started looking at PA schools as a reasonable next step in my professional career. So and it's been great. I've been able to kind of, I don't want to say leverage maybe that concept of practicing as a PA overseas into a lot of different really exciting things that I've been able to do over the years because of that first exposure through Peace Corps and the PA that took care of us there.
What a great example, because I think being a medical director for the Peace Corps is probably one of the harder jobs. You think you're taking these young people, and you guys are a little bit older, but still and introducing them into areas where there's different disease, there's different foods, everything is a little bit different, and you're trying to prevent, doing a lot of education. Our medical director was a physician, and I remember a couple things that she really had to work on with our group is not just personal safety of the female volunteers, but we had Ebola break out around us, and trying to navigate, what did it mean about, the types of food that we ate? Are we allowed to eat game meat? All those different things. And this is way back in the 90s when there wasn't much known about it. Yeah. And so here's our Peace Corps our medical director trying to figure out, what is the right things for us to eat? What shouldn't we do? How to be safe. There was a lot of things, and I always look back at her and think, oh my goodness, what a tough job. So seeing you had a PA, that is so great, because they were sometimes learning on the job, because these aren't things that we're necessarily trained on when we go through PA school. So what would be your advice for anybody that wants to go to the Peace Corps and potentially go into PA school after? What would be your advice to that? I actually get a lot of people ask me this question because I do a lot of speaking.
About the Peace Corps?
I get questions on whether Peace Corps service will count for medical, patient care or something like that. And some schools do actually count it, but
or like what you did with your master's degree. There's that, I forget what that's called, but there is something.
Yeah, so there are ways to do it. Then I went and got I did my doctoral degree after I got back while I was a PA in epidemiology. But, people want to know, can I go serve in the Peace Corps and then apply for, PA school? And so is that a route that you would suggest, or what advice do you have for others?
Yeah, I don't know. I mean, what do you think? I have a hard time drawing a correlation between Peace Corps service and being a my experience was, I think, unique. And I never heard of this before, and I knew this is what I kind of wanted to do. I think if you are considering a practice overseas as a PA, there are a lot of opportunities out there to do that. Whatever path that you take to get to that point, there are lots and lots of opportunities. True. State Department, hires a lot of.
And they actually exhibit at conferences where they're looking for PAs, and where you can be the medical director at a site through the embassy and take care of families that the embassy serves, and
Yeah.
those are great positions.
Yeah, they really are, and they do a lot of exciting stuff, and it's this great mix of family practice, emergency medicine, and austere medicine. But even beyond that, there is, like we were talking about before, there is a lot of interest in U.S. trained PAs overseas as people try to figure out ways to fill healthcare gaps that they might have, and that idea that we were talking about before with NCCPA certification as a benchmark. That's really important. And overseas, they see a lot of value in that. There is a lot of value in that. It's a standard that a lot of countries would aspire to, whether they are doing something a little bit different to get there, their own certification exams, those sort of things. NCCPA is still a model for that in a lot of places. And if you're looking to do that kind of thing, you get the experience that you can over here, maintain your certification, and there are lots of jobs out there. I think if you looked at the number of PAs, U.S. trained PAs that are working overseas, it's a big number. There's a lot of folks out there.
It's more than we realize.
Yeah, for sure. And Peace Corps is another good avenue.
It's one way to work on a language, get really good at living in different cultures. Some of it public health. It would be the public health part of the Peace Corps that's really more relevant to going into PA school. Maybe it's even if you want to be a teacher, that actually maybe you want to be a PA faculty, so that would be relevant as well. So there's a lot of transference of skills.
It's true, and just back to your original question, volunteers. A lot of volunteers in the Peace Corps are in some kind of healthcare sector.
Yep.
And that sort of work can translate, like you say, into a PA education. It's a good background and foundation.
Yeah, I was lucky that it did translate so well, because other roles wouldn't have. Like if I had gone in as a teacher, that would have been a little harder.
There are different things to do, but if you have that kind of interest and you have the opportunity to join the Peace Corps and work in the healthcare sector, why not be a
Go
PA?
for it.
Yeah, absolutely.
I always tell people,
it's a great
once
experience.
you're done with college, don't rush and just do the next thing. Do some volunteer, do AmeriCorps, Peace Corps, figure out what you're going to do, and then you're more ready to make a long-term commitment to your vocation.
Yeah, and it's a great way to be able to give back in a unique sort of way. I'm a big fan of AmeriCorps and the work that they do.
You really have to understand the resources that are available. So I did a lot of teaching of, there's a PA role in Laos, the Lao PDR. But when you're working with and you're teaching medicine, making sure that you're always relevant to the country that you're in. You wouldn't say, use this medication. Of course, they may not have access to it. So the first stop that I always do is I go to a pharmacy and I make sure that I know exactly what medications are available and the cost, so that when you're teaching wound care, I used to teach wound care and different trauma topics for the Lao PDR in some of their schools, and where I'm working with healthcare professionals, sometimes doctors, nurses, and sometimes they do have a PA role there that the country has been working on for about a decade or so. And making sure that all that you're teaching is very relevant, and you're offering a lot of questions and getting commentary too, because they'll say, but what about this? Or, in this part of the country, when you get a burn, people put toothpaste on it because it has an immediate cooling effect. How do you educate people not to do that and stuff like that? So you have to have a lot of dialogue so that you're teaching things accurately.
When you were teaching there, did you ever run into like PA equivalents?
Yes, yeah, there are PA equivalents. It's a much different role there. So after a student graduates from high school, they're chosen from their region to attend a health sciences college. And there's a 3-year degree that's kind of in between nurses and doctors there. And so we would go work with this group of students to talk about very common issues. And we actually worked with the Ministry of Health on topics they wanted us to teach. So it wasn't something that we decided. We really worked with the local physicians in the Ministry of Health.
Mm-hmm.
And in the country, they really wanted us to focus on trauma modules for car accidents, ABCs, wound care, very basic, because that's what they were seeing a lot of.
Mm-hmm.
They would say, well, we're proficient in, dengue fever, treatment of fevers, in infants and stuff like that, but this is really where we have some gaps. And so we would create these modules, and we would do teach the teacher type model where I'd work with their teachers,
Okay,
and then
yeah.
I would sit in the back, and then the teachers would actually present the material, and I was there as a support for other questions. But we would work with and usually the teacher could be a nurse or a doctor or another PA type role.
Mm-hmm.
And I was just there as support. So I wasn't always the one delivering all the material. I was just there helping with the material in a way, supportive role.
When you did that, how long have you been a practicing PA?
At least 15 years. Yeah, and I'd been already a faculty member too, so I've been a faculty member. So you understand some of the principles of teaching, especially adult education. And remember, English is not used at all. It's not a national language. So everything in Lao had to be done in Lao. And so that's another reason that we would have one of their healthcare providers deliver the content.
Have to do it through
Yeah.
like an interpreter.
Right. And I would have an
in effect.
interpreter sometimes directly. And if I did have an interpreter, it was always either a physician or a nurse or somebody like that, because medical terminology is so difficult to interpret.
Yeah.
And so you couldn't just have a regular interpreter with you. You had to have a healthcare provider.
I'm always interested in this idea of PA equivalence, and over this past year, and through the work that you're doing for NCCPA too, you get to meet some of these folks overseas that are PA equivalents. They call themselves different things, but they're doing similar sort of jobs, and the value that they bring to healthcare systems everywhere. And then what they look for when we go overseas to work, as far as our certification goes. And I've never been asked for anything other than my NCCPA certification when I go overseas to work, because that's really held up as the standard, for the profession. If they see this, then they recognize that there's a certain standard that I've met.
And it's a rigorous standard.
Yeah.
Very rigorous.
Absolutely.
Yeah. Mm-hmm.
They don't really. I've been asked for other things, but if I did not have my NCCPA certification, they wouldn't be interested in my coming over there to work. And I see that, when we work with people from overseas and some of these international conferences that NCCPA has been invited to, people recognize that credential as a high standard, and look to that as the benchmark for an emerging profession overseas, for sure. I think that's really exciting. I think it's
we're lucky.
Yeah. It's pretty cool. There are challenges because trying to get CMEs overseas.
Category 2.
It's like, oh my gosh, this is super hard, but
yeah.
It's doable. It's all very doable, and I've been to some pretty cool places and claimed it as CME.
You better believe it.
So there is that benefit. But
There's never a day PAs aren't learning something,
yeah,
right?
yeah, and being able to, I mean, it's exciting. I mean, you know, just that there are all these opportunities for PAs to apply the knowledge that they've gained through education and a practice to a different kind of practice model, like being overseas, right?
Right.
Like being able to teach a 20-year-old, how to take care of themselves, right? And how to deal with stress and anxiety
And isolation.
and isolation.
Mm-hmm.
What are good coping skills for those sort of things? How do you stay safe in this particular kind of situation? Those are all great skills, and I think maybe not at the time. I don't think there's any volunteer that's going to say they appreciate the administration that's supporting them at the time, that's telling them you got to stay in sight and you got to do the job. But later on, they're going to see this as, these are great life lessons. And one of the great things about Peace Corps volunteers is I don't think you'll ever find one that said, I don't regret. It was
true.
The hardest thing I ever did,
Yep.
but I don't regret 1 minute of it.
I think it was life-changing in the fact that some of what you've already described is that you are learning to live on your own. And even for me, I had 2 postmates over time. Each of my postmates, for various reasons, decided to leave. So I felt so isolated at times because I was by myself. I had my dog. My dog, I credit saving my life. I always say my dog saved my life. Long story, but he actually did. And so, but you don't even realize that you could be by yourself in a couple days travel away from the capital, and you really have to learn a lot of skills, of almost survival skills.
You really do. I mean, it's simple things, right? About
like getting water.
I
had no electricity. I had no water. How to pull water up from a well. Using hurricane lamps.
How to avoid snakes.
That's right. Snakes, scorpions, killer bees. I had killer bees in my area. I remember in the maternity hospital, even the women in labor got up and ran. Everyone stopped and they listened, and everybody took off out of the hospital, even if they were in labor. And come to find out, and you should always just follow people out when that happens. Just don't sit there and go, what's going on? But there was the most giant swarm of bees that came and landed on all the mango trees around the hospital.
Really?
And it was an open hospital.
So it was like in the courtyard?
Yeah. It just came and they landed, but all the hospital was open. And so there was bees everywhere. You couldn't actually move because these are more aggressive bees. And so when you see a woman in labor start to kind of run, you're like, I'm following. I don't really know what's going on right now, but I'm going to just follow the crowd here. Okay, so John, I have another question for you. So you went from the Peace Corps and medical director in Malawi, and then what about your practice in the United States? Because I think this experience that you had has really helped inform how you practice as a PA now. I really want you to talk a little bit about that because it's so interesting.
If nothing else, it's taught me how to be resourceful with what I have. What you're doing in a different country isn't necessarily better or worse. It's just different. And being able to apply that kind of flexibility and adaptability to the work that you're doing over here, or at least that I'm doing over here, has been, just really beneficial. I currently, work in Yellowstone National Park. I work in the clinics that are there seasonally, and then I also work up in Alaska in a fairly remote area. Although it's, it has really good resources, it's a long ways away from, anything that you would call definitive care. And being able to, and other places that I've worked in a Western medicine format, such as Midway Island out in the South Pacific, again, you have all the resources that you might need, but it's a long ways away from where you ultimately need to get your patient. And so, being able to use that adaptability and flexibility to accomplish the objective that you have at hand there. And again, that's just something that I've been able to take away from all the time that I've spent overseas as well.
So I imagine in Yellowstone, you're working with tourists, and you're working with a lot of people that are traveling into the state on vacation or whatnot. What are some of the more common things that you see from your day to day as a PA?
Well, the first thing I want to say,
I want him to say bear attack, but I don't feel like that's.
you don't see many of those.
Oh, shucks.
Bears are a lot smarter than that.
I want to hear some animal attack stories, or got too close, but.
Yeah, well, some of that.
See, now I'm putting him on the spot.
Some of that happens, but again, the idea, we were talking about, Peace Corps and working overseas, and you working with the population they have and meeting them where they are. Those are the things that you're doing. And when you work in a place like Yellowstone, it's kind of the same.
Mm-hmm.
So nothing specific, but the great thing about working in Yellowstone is people don't want to come into the clinic. They're on vacation, and they're out there to have a good time.
It's the last thing they want to do.
Yeah.
Right.
And a lot of them, they spent a lot of money to get to this place. And then it's like, I'm having chest pain. I'm not going to tell anybody about this because that's going to ruin everybody
We're going to brave it out.
Vacation.
At a higher elevation.
So by the time you actually see some of these folks, they're well down the road, or you're talking them into doing the right thing. But the beauty of that is you meet the person where they are. And people in Yellowstone don't want to come into the clinic. They're excited to be in the park and on vacation. And so when I talk to staff about, how do we approach this, it's like, this is a motivated group. They want to be on vacation, and my job is to try and keep them on vacation.
Well, they're in denial. There's a lot of denial there.
Just a river in Egypt.
Yeah. They are like, oh, I'm sure this is just that old heartburn acting up again.
Yeah, you hear that
remember
a lot.
my background is emergency medicine, and I've heard every excuse to talk me out of thinking it was chest pain. And I'm like, okay, I know you think it's heartburn, but we're going to actually make sure and do these tests for you.
Yeah.
And a lot of times, most of the time, it tends to be something more serious.
Yeah, and there's a lot of examples like that. People, and the other piece of that is, folks who are in healthcare elsewhere doing their research before they send folks out. So when, what do you say? The person with stage 4 lung cancer comes in and says, Yellowstone is on my bucket list, and their primary care provider who's living at sea level says, go for it. You think, maybe do a little research and recognize that Yellowstone's at 8,000 feet.
Yeah, I forget that it's at such a high elevation.
Yeah, and people may, with some kind of compromise like that, are not going to be doing
and it's
well.
such a sudden change.
Yeah.
with a compromised lung.
Big
I just
time.
can imagine that it's you're going to see some
Yeah.
issues there.
Folks walking in with a O2 sat of 55%.
That gets your attention.
Yeah, it does. And but they're on vacation, and it's like, can't you just sell me a bottle of oxygen? I'll just
Be on my way.
be on my way.
I'm portable oxygen.
Old Faithful's going to go off in about 20 minutes. I don't want to miss it.
Oh man.
I'm on the clock. So that's a piece of it. Every PA is a mental health PA, and that includes things like this. Meeting the person where they are, listening to what they're saying, and understanding their motivation behind what they're saying. It's not that they don't recognize that there's a problem. It's just that they have a different take on that problem. And I might roll my eyes and I might say, you could die from this, but that doesn't help, the person. It's a very different thing to say, I hear what you're saying, I understand where you're coming from. Let's just kind of look at this and let me talk to you about it and give you a little bit of education on this, and then so you'll at least be able to make an informed decision.
It's a more thoughtful approach.
Yeah, absolutely. People for the most part, want to do the right thing for themselves, right? They just have that different motivation.
That's right.
that you need to, if nothing else, acknowledge. People are going to do what they want to do. You just need to make sure that they're making an informed decision in situations like that. And that's true, in any kind of austere or remote setting. It adds a little bit of a layer to what you're doing. It's a lot easier to do that in a clinic when you're sitting across the desk from, a healthcare provider, a PA, than it is when you're, laying in the snow and it's 40 below, and it's like, let's talk about
Are you
this.
talking about Alaska now?
Yeah, it was pitch dark out.
Are you seeing some frostbite injuries and other things when you are working as a PA there, or what are some
interesting thing about Alaska is, at least where I am, people are very safety conscious, and they're very aware of the risk that they're putting themselves at. So in those situations, when we were talking before about situational awareness and being aware of what's going on around you, people are very aware of that. They understand that they're in risky situations, so they're better about that sort of thing. And I don't see a lot of frostbite. You see some, but it could be much worse in a place where it's dark 24 hours a day and it's 40 or 50 below outside all the time. Could be a lot worse. So injuries that you might see or things that you might see there are a little more significant, I guess, because if a person hurts themselves, it's not because they're not taking the appropriate precautions or doing the right thing, wearing their Arctic gear, paying attention to things that might be harmful to them. So those sort of things are very different than what you might see somewhere else.
Yeah, similar even in Minnesota. You don't see that as much because people are
People
pretty
know about
well versed on it.
Yep.
Yep, so true.
Now you can take, like in Yellowstone, you can take somebody that's at sea level and they're going to come up to 8,000 feet and might get themselves into trouble because they don't know about that. And then they're up here, and then all of a sudden it's an emergency because they're well-intentioned, but they haven't done their research. So that's always kind of a big thing to take away from that, is make sure you do your research before you do something like that. And that's, I think about, the time that I was a medical officer and teaching volunteers. It's a big piece of it. It's a big piece of it whenever we deal with patients, right, is educating them. We have a lot of medical jargon, and we have a lot of mysterious things that we do all the time. But really it comes down to making sure that your patient has the information that they need to make a good decision, if nothing else. Whether it's, you may not be able to breathe well at 8,000 feet, or you could get frostbite if you walk out in 50 below, or that lion over there might...
Don't go swimming in Yellowstone?
Yeah,
is that advice you've had to give out?
There's that, yeah. Don't go swimming in the 40-degree water.
You might dissolve.
Oh, yeah. Well, that's happened. So I think, whether you're overseas, practicing here, that's really the foundation of what a PA does, and what we do best is that little bit of extra time and education. So we at least know that our patients, or the people that we serve, are making informed decisions.
That's right.
I think that's the best takeaway that you could take from all of this. I really do believe, that this sounds a little hokey, but I'm going to say it anyway. The world changes one person at a time.
Mm-hmm.
And if you're sitting down with either it's a patient across from you, or it's somebody that you smile at today, you're helping that person. You are creating a pathway to a better tomorrow.